Because I think we all know, I mean, we were talking earlier in the hour about, this business of having, the 2 million people who are going to be claiming benefits because they're suffering from some kind of depression or anxiety or something like that. We also know the unspoken sort of truth is that there's a couple of million people in this country who are kind of below the line of everything. They don't really pay for anything. They don't really pay for their property. They rent probably, but they get that paid for by the council. They're on benefits, so they don't really pay for anything at all, and they probably don't have the money to pay for their electricity or their gas. And so what do you do with people like that?
Yeah, it is difficult because it does seem sort of immoral to have people who, especially if they are capable of working, there might be the case that you have got some people blagging, they're a little bit upset and they decide, oh, I'm depressed, let me get all the benefits. We don't know, it's always hard to measure to what extent that happens.
Yeah, but there's an awful lot of them, and my view would be
but you can stack all these things up, and it really doesn't seem fair if you've got people, we've now got this rise of the working homeless, right?
Yeah.
People who are working a full-time job but still can't even afford to pay rent, whilst you've got other people who aren't working at all and have everything paid for them, and now don't have to pay energy for energy at all, potentially.
Right.
It just seems unfair.
But it is unfair, but that's what I'm saying. What do you do about that? You can't force people who break the law into not breaking the law. It's a bit like telling people who don't have insurance on their car, well, you must get insurance on your car or else we're going to fine you. They're not going to pay the fine. They're not going to get insurance. There's no real instant kind of fix for that.
There's not, sadly, and society's never going to be perfect. And there's always, yes, you could spend a load of money on enforcement to make sure that there isn't a single person breaking the law, but it's not going to be worth it. Opportunity cost, right? We sort of just have to accept that there are always going to be some people who manage to bend the rules and live in an unfair way. Sadly,
we will have to accept it, but we don't have to keep encouraging them to continue to do it and to increase the numbers.
Yeah, there's things we can do to stop it.
Like if people start telling me that they're anxious about the climate, I'm not giving them a week off. I'm going to tell them just to, put a coat on and come in.
I think that's such a good point there, that we've seen those numbers of people who are being signed off work for anxiety and depression, and they are forecast only to go up. And I think your point is correct in that for too long we have seen the anecdote to mental health to being off work, to be isolated, to be at home to recover. And while that may be the case for some people, and that needs to still be in place if that's helpful for them, actually work can be part of the solution of people coming back into full health and not being isolated and not being stuck in loneliness. So the numbers of people who are claiming welfare, and over 50% of them report having anxiety or depression, the answer to them must not be park them on welfare and leave them there, because that will make their mental ill health even worse, most likely. It must be a stepping stone back into work, and therefore the welfare system bill is just going to continue to rise unless we see work as the solution to some of these ills.
But importantly, this is also another unintended consequence of lockdown, right?
Absolutely.
The most disastrous public health decision in our history.
Isn't it funny, though, how many people now say that it was wrong, who didn't say it was wrong at the time? We've been saying it was wrong for a very long time, since it was going on. So I was saying since my kids were told not to go to school, kids should be going to school. And now everybody says, oh, of course, it was a bad idea not to send kids to school.
Absolutely, and there are 140,000 kids now who are out of school more than they are in school. And that's what we have found in our research at the Centre for Social Justice, where I work. These kids from the most disadvantaged families who are opting out of education. And then what is their future? Their future is probably very difficult finding a job, more likely to get involved in crime. That's what we found. Families that are really struggling, parents who are not necessarily in work themselves. And so the cycle continues. And that, unfortunately, is correct, that lockdown for many people broke the link between school and compulsory attendance.
And the problem is it's getting worse. I mean, we're going to be spending by 2030 £80 billion a year on ill health, which is half the cost of the entire national service. And this happens at the same time that the public, post-lockdown, are becoming more aware of disability benefits and more aware of what they can actually use.
Yes, absolutely. Well, I saw it with my own children during the pandemic, where, they're sort of, you might call, they didn't have that much respect for the school beforehand, but by the time they hadn't been there for about 6 months, they had even less respect. And particularly when they went back and the teachers were on strike, and they went, well, they're not bothering to turn up, why should we? And that's the problem.
Yeah, absolutely. It's quite nice, isn't it, how all of us conspiracy theorists at the time have been proven right about the ills of lockdown.
Right.
I mean, the impact on children, such a crucial stage in your life, and years that you just don't get back. It's just criminal, if you ask me. And what was mad to me was that with the COVID inquiry, they initially weren't even going to investigate the impact of lockdown on children, on students.
They're still not really doing it very well.
They didn't think it was relevant. They didn't think it was a big problem.
Yeah.
And this has affected the mental health of so many children for a long time. It's not the case that as soon as lockdown stopped that all of the mental health problems were solved. No, it's lockdown put people into the beginning of a downward spiral for a lot of people, both children and adults, and they are still, you know, several years on, facing the consequences. And that's definitely in part why we're seeing this big rise in the number of people claiming mental health benefit. It's not just more people saying, oh, I'm a bit down, I've got depression. You know, genuinely, I do think mental health has declined.
Well, I think a lot of it as well has to come back to the NHS and how that's failing people, because I know lots of people who have been trying to get access to mental health care for their teenagers, for example.
You can't get it.
You can't get therapy.
They just give you medicine. They just want to prescribe you medicines, which is just a Band-Aid. It's really hard to actually get therapy without paying an arm and a leg for it. Most of us, especially in a cost of living crisis, can't pay 80 quid an hour plus for a therapist. It's just not possible.
But also the good enablers of mental health in children, young people and in adults have been stripped away. So we've talked about work being a good enabler of mental health. It supports your mental health. Family and the family and home environment is a huge implication for children and young people. And we know that those who have a more stable family structure have more positive mental health. But you go to your GP, they won't ask about your family situation. They will most likely prescribe you a medication. But there's so many non-medical interventions to improve mental health when it's on that lower end. I'm not talking about acute illnesses, which are very much need medical attention and clinical diagnosis.
Probably quite small in number.
But those more well-being ends of mental health, things like sport in young people, looking at the home environment, all of these things are missed from the conversation and they need to be brought back in.